Hi everyone, welcome back to Gina Frabotta Pilates. If your back is feeling tight, stiff, or heavy, then this class is for you. In this session, we'll be using gentle, intentional Pilates movements to release that tightness and that stiffness and create space in your spine. You don't need any other equipment other than you, your mat, some time to breathe and move. So listen to your body, take your time, and let's get started. We will begin on our hands and knees. If being on your hands creates tension in your wrist, please go ahead and just rest onto your forearms. You could even place a chair here or a couple of yoga blocks to press your forearms on as we do the first couple exercises on our hands and knees. So let's begin. Up onto the hands and knees here. You're going to take your pelvis and draw a big circle on your mat. Start to the side, shift to the side, going backwards to the other side, and then forward a little bit. And take that circle around. You try your best you can to keep your abdominal muscles pulled in so that you don't have all the weight leaning into your wrist. The more you can think of pulling up and away from the mat, the less pressure on your wrist. One more circle this way. And then also too, we'll go the other way, circle around the other direction. Press through your finger pads and your knuckles, and that should also take pressure right out of your wrist. And let's go around one more time. And then back to center. Going right into our cat-cow. Start this movement at your pelvis, right at where your navel pulls in towards your spine. Move through one vertebrae at a time until the last 2 points, your head and tailbone, are down. And then we'll do a cow. Start at your pelvis. Your navel leads, and then you work your way through your spine. And we'll go again. Pelvis. Try not to skip any parts. Take a deep breath in. Exhale as you extend. Inhale. Exhale one more time. Flow through your spine. Pause at the top here. Move your cat around a little bit. And then extend one more time into your last cow. Back to a neutral spine, which is creating a nice straight spine here. Now we're going to do a side bend. So head and tailbone are both going to go to the left. So you can look towards your tailbone and then come center and then to the right. And then to the other side. And inhale, pass through center. Exhale to the other side. We want to try and keep our spine in the center of your mat and just bending it rather than moving our hips away from the center of the mat. So your navel stays in a space hold essentially, and everything above your navel bends to the right, and everything below the navel bends to the right. So 2 parts, think of it. Let's go one more each side. This one isn't done that often, but I think this an especially good one, as we can get very tight in our side bodies, especially when we're sitting for long periods of time. Okay, let's take this down onto your back. We're going to go into a pelvic tilt here. So rather than pushing into the mat, what I want you to think about is using your abs to pull your hip bones to your ribs. So you're shortening this distance in the front body using the muscles between your hips and your ribs. So that's very different, right? I'll show here. Drawing my abs in, pulling my abs this way, right? You shorten a muscle, you contract a muscle, it shortens. So you're shortening this distance. I'm not even thinking about my back body. So oftentimes I'll see people with pelvic tilts pushing and using the glutes. Not the way we want to do it. You want to draw the front and then release back to neutral. Draw the abs into the front body, doing a pelvic tilt here. You can even put your hands right here, one on the bottom rib, fingers and one on the hip bones. Pull those 2 points closer together. This will really help release your low back if you do it correctly. If you do it incorrectly, it can actually make it worse. So draw in those 2 points using just your abs, just the muscles between those 2 points, and release once more. And release. Now you can bend your elbows. We're going to push your upper arms into the mat. You're going to do a pelvic tilt again. Now I do want you to use your glutes and start to go into your bridge. We're going to go slow, and you're going to roll yourself up to your shoulders, a very slow bridge here, pushing your arms into the mat without going too high and opening your chest up. And then slowly take your time and roll down. Now, if you have stenosis in your back, low back, you want to always keep a neutral spine. You don't want to do big rounding movements in your spine. So you can do a bridge. You're just going to go straight up and straight down. Same thing with osteoporosis. You don't want to round if you have it in your spine. Arms down at your sides. Repeat. So your pelvic tilt, right? We're peeling away from the mat rather than pushing into the mat. So getting all parts of our spine to move. And we got one more bridge, but this time we're going to stay at the top of this bridge. Now, without your knees moving, we're going to dip your left hip down to the floor, just a little, right? Don't let the knees move. Bring that hip back up and drop your right hip. Essentially, what we're doing here is a spinal rotation. Usually we hold the pelvis still and we twist our upper body when we're standing or sitting. So this is opposite of that. We're stationary here with our upper body, so our pelvis and low torso can move. This should feel good in your low back, but you can't move your knees. If you need, put a ball or a yoga block between your knees. And don't force. Never force anything. You just go to the point where you can comfortably move and then back one more time. And that is it. And then we're going to roll back down. Great. Okay. We're going to bring our knees up and put our hands on the outsides of the legs, holding the kneecaps. Now, bringing one leg slightly in and one away. Here we want to get to the point where our arms are doing most of the work. So if I were to let go with my arm, it's holding the whole weight up. That leg would just fall. So I don't want you to hold your own legs up. I want your arms to take the weight. So that's kind of what this first part is about, is essentially trying to understand how the arms should be doing that. And then this is good for the hips and low back. Your arms will draw circles, little mini circles in the hip socket here. And then we're going to go the other way. Again, your arms are taking the weight, and a lot of our weight in our bodies in our legs, so your arms should feel it a little bit. They should be working to hold the weight up. One more circle around. Good. You can hold your right knee here. Place your left foot down on the ground. We're going to hold this up in a tabletop, and I want you to push and resist and hold. This engages our psoas muscle. That's a deep, deep core muscle, hip flexor muscle. Oftentimes, back stiffness can come from that psoas being tight. We're just going to get it active a little bit right here. Don't mind releasing already. And then set it down. Let's try the other one. Leg up, hold. You don't always have to stretch a muscle to stretch it. You can work it to stretch it. I know it seems maybe opposite, but that is true. You can also stretch a muscle by working it. It doesn't have to be just a passive stretch. So you're pushing, you're holding, and then we're going to go down. And you're going to stay in a neutral pelvis, so we're not doing pelvic tilt, but you are going to use your core muscles to hold everything in here as we float one leg up to a tabletop and back down, and then do the other one. Come back down and lift. So there should be no movement in your pelvis, either front or back or side to side. And how do you keep it still? You use your core muscles, front, side, and back, right around the pelvis. And using your core muscles can help release tension in the low back. It doesn't have to be just stretching our low back to release tension. Working that deeper core can also release tension in our low back. Last two, and last one. Now into some knee sways. Arms at your sides, palms down. So I'll always start small. This is a big movement. We're going to work up to a big movement. So you don't want to just drop your knees. I can pull a little bit on your back. So we start small and we gradually work into a nice knee drop side to side. Gradually getting bigger and bigger. This is a spinal rotation, right? We're rotating here in the lower torso. And I'm almost to my full range of motion now. So the next time I'm going to go ahead and hold. There it is. Now take a deep breath. Here, you can let your ribs expand and widen. Also inhale. Think of lengthening in your spine and widening in the ribs. And exhale, pull back with your core. Squeeze your belly to pull the legs back. Let's drop to the other side. Inhale, widening. Exhale, get heavy. Inhale, get long. Exhale, abs pull in, pull your legs back. Okay, grab the back of your left leg. So here, we're going to be pushing and pulling. So what that means is my leg is gently pressing away, but my arms are pulling. So the leg doesn't go anywhere, but we have resistance. We're active in the leg. And then exhale, extend, and bend. This is to get into a hamstring stretch. But oftentimes, this can go into our low back not in a good way. If we're not actively using our leg, our legs too close to our chest, it goes into our low back. Now hold, flex your foot, and on the exhale, go ahead and walk up the leg, and walk down, and walk up. Keep the push-pull, and walk down. Last time. And walk down. All right, let's switch. Push-pull, extend, inhale, bend, extend, inhale, down. Abs in, hamstring is pressing, arms are pulling. Last one. Now exhale, walk up your leg. You can flex your foot and point. Two more. Abs pull in. So don't let your back get pushed further into the ground. You hold your pelvis still. Hold here. We're going to do a little scissored leg. So grab the leg, do the push-pull, and switch legs. Push-pull. Squeeze your belly. We'll go 4, 3, 2, 1. Go ahead. Bend your left knee. Put your left foot down. We're going to hold the right knee to the chest and extend your left leg long. Now, this one isn't about being passive and just relaxing. It's very actively reaching your straight leg long and gently pulling your other knee in to stretch through the front of this hip here. Tight hip flexors can create tension in the low back. So as I'm stretching, I can feel it continuing to stretch. I don't just get there and relax and hold. Then I'm going to take just the one hand and bring this leg out to the side comfortably as far as it will go without the pelvis lifting. This side here, this stays down. Just let it get heavy. Right on your exhale, it starts to get lower and lower to the floor. And then bring it back in with your arm. and switch. Okay, you guys are doing good. We're almost there. So stretch in, reach your straight leg long as you gently pulling your other knee into your chest. It continues to stretch. Continue to straighten your, reach your leg, straight leg long, and then with the same hand on the leg, start to bring that leg out to the side. Keep your opposite side pelvis down. So you'll feel it start to get heavier. You don't want to drop it all the way. You still use your hand to pull it back on the exhale. Into our last stretch, we're just going to do a big spinal twist. So with the legs together, gently set them all the way down to one side and look the opposite way. And here we're going to breathe. I'm going to put my hands here so you can kind of see where I want you to focus with your breath, that you want to create space here between your ribs and your hips. So on your exhale, the ribs are going down towards the floor. So the hip is gently reaching the opposite way. You don't have to do this with your hands. Just so you can see on the exhale, you're trying to open that space up. Same thing with this exercise. This is pretty intense. You don't want to just throw the legs out. So I'm going to exhale, bring one knee into the chest and then the other one. And then we're going to go ahead, set them down to the other side. Another full breath in and out. And remember, actually what we'll do here is we're just going to roll to the side and push up. So roll towards your legs. Use your hands, push yourself up. That's always the best way to come back up after you've been laying down or on your side. Okay, and that's it. And I hope your back feels a little bit more stretched out. If you did like this video and found it helpful, please like and subscribe. And I hope you guys enjoyed and have a great day. I'll see you next time.